to Leduc Physio's YouTube channel. I'm your host today, Tennille McGee, physiotherapist. Today we're going to talk about heel pain, and specifically the heel pain that does not want to resolve. So the typical signs of plantar fasciitis are stiffness in the heels. Usually you'll feel it when you first wake up in the morning or the first few steps after you've been sitting for a few minutes. Generally this type of pain gets better after walking for a little bit, but if you've walked too long or you ran or you stood for too long, the pain can start to get worse again. If you're experiencing heel pain, the first thing that you should do is see a physiotherapist for an assessment. What's most important is we need to figure out why the heel pain is there. Generally there's a muscle imbalance, you might have some weakness somewhere in your lower limb, there could be some loss of joint mobility or a tight muscle that's causing the problem. When heel pain first starts, what's going on below the surface is an inflammatory process. This inflammatory process generally lasts about 6 weeks or so. After this, the body should generally start to heal this injury on its own. What happens sometimes if we don't resolve the cause of the initial heel pain is that the heel pain will continue to keep happening long after the 6 weeks. If you've been to physiotherapy and you've been doing treatments and stretches and working on your muscle imbalances, and after 6 weeks the pain has still not resolved, our next step is generally to recommend shockwave therapy. Shockwave therapy is a modality used against the tendon to help with healing. So we create metabolic stimulation, which will allow for tissue healing. It will also break up any of the calcium deposits that might have laid down in the area from heel spurs and such, and increase the amount of circulation that you're getting to the heel and allow the body to start healing itself. At Leduc Physio, we have lots of different treatment options for heel pain. In addition to traditional physiotherapy and exercise, we also offer intramuscular stimulation, which can help decrease some of the tight muscles that you have in there. We also have massage therapists here. We can do custom orthotics if the problem is because of a flat foot, as well as the shockwave therapy. So there's lots of different options that you can have all under one roof. So now we're going to demonstrate what a typical shockwave therapy treatment looks like for plantar fasciitis. Okay, so the first step in the treatment is to identify the places where the pain are. Generally, the plantar fascia attaches in here, so this becomes our main area of treatment. Then what we do is we'll feel along and find a few other places where she's tender and mark those as well. Good, and then we'll also go up into the muscle and find a few places in here where she's feeling tender or tight. Great. So the majority of the treatment is going to be done right at the plantar fascia attachment, but we're also going to hit some of these other places where she's having problems. So what we do is we apply some gel to the head of the shockwave, and then we're going to put the shockwave head onto the plantar fascia and turn on the machine. So what we're going to do is work mostly along here. And then we will also move to our other sites of pain. Good. So we would continue the treatment for up to 3,000 pulses. I just did about 50 here just to get us going. The treatment is a little bit uncomfortable, but it doesn't last that long and it's tolerated well by everyone. Thanks for watching today. Please subscribe to our YouTube channel.